Let's bring in Dr. Nesochi Okeke-Igbokwe. She practices internal medicine. Doctor, thank you for being here. J&J is less effective than other vaccines. That's what the data seems to suggest. I also read that Pfizer loses about 6% efficacy every 2 months. Doesn't it kind of seem like boosters are going to be inevitable?
Absolutely. Boosters are going to be inevitable, but at this point, we really have to determine who needs these boosters more so. And right now, there's a cohort of the community, of the population, namely the immunocompromised, those with weakened immune systems, that will benefit from this the most. When we're talking about this group and this cohort of people, we're talking about that small population of people that have weakened immune systems, maybe perhaps because they are cancer patients on chemotherapy, they are organ transplant patients, they are patients with chronic autoimmune diseases or patients with chronic illnesses that require them to take immunosuppressants. So the forthcoming recommendations for the immunocompromised to actually have a booster shot is actually driven by certain studies, by certain data. There is some level and body of research from New England Journal of Medicine, actually, that did show that those that were transplant patients that received a third dose of an mRNA-based vaccine, they were able to actually have some more immunogenicity, meaning that they were able to mount kind of a robust immune response after they received a third dose of the mRNA-based vaccine. So the data that is available kind of supported the need that this cohort of the immunocompromised, they're the ones at this moment in time that will benefit most from it. Will other groups of people need boosters moving forward? Perhaps, but only time will tell, and we really need to continue to monitor and check what the data is telling us.
Now, in the meantime, I heard the owner of the LA Times, the newspaper, he's actually also a brilliant doctor, and he says he's working on a cure, what he considers a universal booster. And he was in the initial round of people who were developing these things, and he said the FDA took a wrong turn just looking at antibodies. He said his focus is on building up T cells. I hadn't heard this before. And that keeps us from even being able to transmit the virus to other people. And he says it's going to be available in South Africa. Do things like that seem promising?
I mean, here's the thing. We have to really follow the science and follow the data. At this point, that study or those that research, that body of research is still set to be in the preliminary stages of actually testing. The clinical trials are set to actually begin at some point this quarter. So it's hard for one to really assess and say if it would be promising or not without actually seeing the results of the study at this point.
I appreciate that because a lot of us get excited about it. By the way, if anyone wants to listen to the podcast, it's called Sway. It's a New York Times opinion podcast. It was really interesting. But I appreciate you, Doctor, saying, wait, let's not get out too far over our skis. Do you think at some point, though, we will be mixing and matching just as a matter of course in the future? For instance, you got the J&J, now you're getting a Moderna. You got a Moderna, well, let's top you off with a Pfizer.
At this point, it's hard to say if we're going to go that route here in the U.S. Other countries have, they've delved into that, mixing and matching various vaccines. But the question really is there that added benefit or something that would actually be good for our immune systems by perhaps mixing an mRNA-based vaccine like Pfizer or Moderna, mixing that potentially with another kind of vaccination that's adenovirus-based, like the Johnson & Johnson. The thing is, we don't have those studies to show us that it's safe and efficacious to do so. And here we base everything that we do on data that we have. You need the data-driven recommendation to make sure that it is a safe way to move forward. So just because other countries may be doing that at this point, is it good for us now? Only time really will tell. And with that said, people should really be aware of what is kind of happening now. And some people are vaccine shopping and taking it upon themselves to just go out and mix and match various
Right.
vaccines. So before you even go there, please, please, please listen to official recommendation from the CDC. Right now, they haven't approved this vaccine mixing and matching. So talk to your doctors if you really have a question about whether or
Sure.
not you should go trying to take another kind of vaccination. But at this point, it is not
Point well
recommended
taken.
here in the States.
Point well taken, because I haven't done that, but truth be told, I've been with my trombone in the front of the booster club saying, let's get another one. So point well taken to slow down. Let's wait for the data. Dr. Nesochi Okeke-Igbokwe, thank you so much.